So let's get started. Good afternoon and welcome to CDFA's Recovery Housing Program webinar. My name is Melissa Latham. I'm the Director of Communications and Policy at CDFA. We greatly appreciate you joining us this afternoon. Anticipate this presentation alongside questions from you all. We'll run from now until about 4 o'clock. Obviously, depending on the number of questions we receive, we may have a little extra time at the end. So today, just to give you a quick overview, we are going to be providing you with a brief overview of CDFA for those of you who might not be familiar with us. And then we're going to dive right into the Recovery Housing Program and share with you some details on program priorities, information on eligible applicants and activities, as well as some evaluation criteria we'll be using as we review applications that get submitted by you all. So we are recording today's session, and we will share that recording alongside the presentation slides. So you'll have those as references as you move forward with a potential application. We'll also send along links to relevant resources that might be helpful for you as you consider doing so. And those will come to you in the coming days. So rest assured, all this content will be packaged up and sent to you via email. If you have any questions, please post them in the chat. We'll be monitoring that throughout, so ask them as you have them, and we'll be addressing them throughout the presentation as it makes sense. So if we could, I'd love to just start with some introductions. Again, my name is Melissa Latham. I'm the Director of Policy and Communications at CDFA. I'm joined here today by my colleagues Molly Kaler, who's the Director of Housing and Community Development, as well as Kirsten Barton, who is our Housing Specialist. If you could take a moment and introduce yourself in the chat, including your name and the organizations that you're here to represent today, that would be great. And if with all that being said, we'll get started, and I'll pass it over to Molly to tell you a little bit about CDFA.
Great, thanks, Melissa. And again, welcome everybody for to the presentation today. Thank you for joining us. We're going to kick off, as Melissa said, by talking a little bit about the Community Development Finance Authority, or CDFA, as we're known for short, and about the work that we do here in the state of New Hampshire. So again, our mission at CDFA is to maximize the value and impact of community development, economic development, and clean energy initiatives throughout the Granite State. We see a future New Hampshire, whose communities are economically and socially resilient, reflect and respect their natural surroundings, and are places where people want to live, work, and play. Our overall mission is to meet the evolving community and economic development needs of New Hampshire communities. And to do so, we approach our work with integrity, we prioritize collaboration, we strive to be adaptable to changing needs and issues, we respect people in place, and make focused investments that promote prosperity for all. There are a number of ways that we invest in the people of New Hampshire. You can see on this slide here, it talks about our main resources. We deploy a well-tuned, effective investment system, enabling partners to make transformational and sustainable changes and take an initiative and collaborative approach to development finance. So we provide a variety of resources, including the competitive deployment of grants, loans, and state tax credit equity. Our staff provides technical assistance to prospective applicants, and these applicants, depending on the program, are anywhere from communities or nonprofit organizations or sometimes for-profit businesses. And then we also work with applicants to understand their project, to align that project with the different types of CDFA funding and financing we have available, to navigate CDFA's application and review process. And then also, if additional funding is needed, or if the funding resources that CDFA has are not in alignment with the project, we work to connect folks with other potential funding resources. So our impact is seen across the state in revitalized downtowns and high quality childcare facilities, and renovated housing, in clean energy projects, in business expansion to provide jobs, and in a healthy, vibrant nonprofit sector. So that's just an overview of some of the different types of projects and different areas where you can see our investments. This next slide is our attempt to show visually our CDFA's funding ecosystem. So CDFA resources enable our partners to identify a community need, then explore ways to meet that need, and then ultimately to develop and implement a solution. We're dedicated to supporting our partners in this work, and we have resources to do so at the various stages of project development, as you can see here. This includes concept initiation. We work with partners to advance new ideas, innovation, and capacity building in community development, economic development, and clean energy, so in a variety of areas. Also, under planning and development, we provide early access to funds to explore a concept and determine its viability, as it's a critical step in the success of a project. CDFA deploys a variety of resources to support the planning and development phases, again, in all three areas, including community development, economic development, and clean energy projects. And then implementation, which is actually the project itself, that is a significant portion of CDFA's resources. And we support the implementation of projects in those three main areas: community development, economic development, and clean energy initiatives. CDFA implementation resources include the Community Development Block Grants, or CDBG grants, as they're often known. The funding we have for that totals approximately $8.5 million per year, and those projects must benefit low and moderate income individuals and communities. And they include projects in areas such as housing, public facilities, job creation, and micro enterprises. We also have $5 million in state tax credits, which support capital projects and the aforementioned L5 capacity building, which also uses state tax credit funds. And then we have the Clean Energy Fund, which is a $10 million revolving loan pool that offers competitive financing for energy efficiency and renewable energy projects. And those are eligible entities for those. Those funds are, anywhere from municipalities to nonprofits to for-profit businesses. And then we also have some community economic development loans available. And then lastly, just a note about sustainability. We continue to support our community partners well beyond the deployment of our resources. CDFA is dedicated to ensuring the long-term success of the organizations that we support and assist with network building, asset management, compliance, and analyzing data and outcomes. So across all of our programs, we offer technical assistance, advice, application guidance, compliance, support, and connection to other funders. So that's just kind of the quick high-level overview of CDFA and what we do overall, and our key programs that you might have heard about that we offer. So what is recovery housing? So today we're going to talk about the definition of recovery housing and how we're defining it, and then also a little bit about New Hampshire's needs in that area. So this program and how we define recovery housing needs and priorities are all set within the context of the SUPPORT Act. So as many of you may recall, the SUPPORT Act was bipartisan legislation, and it represented Congress's most comprehensive response to the opioid epidemic to date. The Support for Patients and Communities Act of 2019, or we shorten it and say SUPPORT Act, it was made up of dozens of individual bills that directed additional federal resources towards a variety of areas that include prevention, education, coverage, treatment, workforce development, and law enforcement. So one of the many programs that came out of the SUPPORT Act that was authorized by this legislation includes the Recovery Housing Program, or RHP, which we sometimes refer to it as. And this program is currently considered to be a pilot program. We've received some additional allocations for that funding, but it's still in the pilot phase. So 25 states received an allocation, the initial allocation for this recovery housing program back in March 2022. So that's when it was authorized. It took some time for the funding to make its way to New Hampshire and become available. But the allocation was initiated back in 2020. And we currently have approximately, or just under, I should say, just under $2 million available for awards to grantees. And that's what we're talking about today, is this money that we have available to projects to support the work that's happening. These funds are treated as community development block grant funds, or CDBG funds. And that's outlined under Title I of the Housing and Community Development Act of 1974, unless otherwise provided in Section 8071 of the Support Act, and modified by waivers and alternative requirements. So that's a mouthful, but basically what that means is that this is federal funding that comes through HUD, and HUD has an existing program, the CDBG program, that we currently administer for a majority of the state, except for a handful of communities, which I'll talk about after. But that current, that CDBG program is the program that this program very closely resembles, and it follows a lot of the rules and regulations for that are set out by the Community Development Block Grant Program, or CDBG program. And I just want to stop here too and just think we had a lot of support, as we often do, from our congressional delegation, who fought hard for this funding to come to New Hampshire in order to increase access to stable, safe housing for those in recovery. So New Hampshire was, identified. My motion sensor lights have gone off the background, so if I'm a little dark, oh, there they go. New Hampshire was identified as one of those 25 initial state grantees based on a formula that the federal government created that really takes into account how hard the opioid epidemic was impacting our state. So that's how it was determined that we were a state that was going to receive this funding. And then there was a formula to determine how much our state would receive. And again, the congressional delegation did a great job at really being an advocate for New Hampshire and making sure that we received some funding as part of this program.
So in the next few slides, we'll go over definitions and highlight expert agencies in recovery housing that CDFA has worked with to develop a program to benefit individuals in recovery in New Hampshire. And also we'll talk about specific New Hampshire needs and link this back to the people we're working to support in their recovery housing journey. So what is recovery housing? It's a safe, stable living environment for individuals in recovery from substance use disorder. And programs typically provide a progression of supports throughout the recovery process. And these two definitions on this slide are from Substance Abuse and Mental Health Services Administration, or SAMHSA, and are included in CDFA's action plan that was published in late 2021. So the National Alliance for Recovery Residences, or NAR, is a 501c3 nonprofit organization founded in 2011, dedicated to expanding the availability of well-operated, ethical, and supportive recovery housing. They've developed the most widely referenced national standard for the operation of recovery residences. They work with and support 30 state affiliate organizations, and New Hampshire Core is one of those. They partner with federal government agencies, national addiction and recovery organizations, with our state level recovery housing organizations, and with state service agencies in pursuit of better and more accessible recovery housing opportunities. And according to NAR, the graphic on this slide represents the 4 levels of housing services for people in recovery, from the lowest barrier, level 1, to level 4, which can include clinical services. So finally, CDFA coordinated with multiple partners to identify recovery housing needs in New Hampshire and ensure the recovery housing program goals were based on data, trends, and public participation. The process to identify needs and establish program priorities included hosting recovery home provider interviews across the state, conducting a survey of recovery homes and other stakeholders, soliciting public input through one-on-one outreach, researching and evaluating best practices and program models. So partners engaged in this process included New Hampshire Housing Finance Authority, the Department of Health and Human Services, Housing Action New Hampshire, and the New Hampshire Coalition of Recovery Residences, or New Hampshire Core. CDFA will continue to work with these partners and others as the program progresses to assist with outreach and to obtain feedback regarding to the program. And most pressing needs currently identified by New Hampshire CORE and supported by the outreach undertaken as part of the development of the New Hampshire Recovery Housing Program indicates there's a greater need in New Hampshire for more beds, housing specifically for women and families, and more level 1 houses. And I'll pass it back to Molly.
Thanks, Kirsten. So before I move on to the next section, we're going to get talking about some specifics regarding the recovery housing program here in New Hampshire. I thought this was a good place to pause to see if there are any questions. And I know we do remind you and encourage you to ask any questions throughout the course of the presentation by typing them into the chat. If it's easier when we take breaks like this to ask for questions, you could certainly unmute and speak if that's easier than typing it. And then we'll certainly set aside some time at the end of this presentation to go over questions after you've heard the whole presentation. So don't feel like you have to chime in the middle of it if you'd rather wait to the end. But I just want to be sure that we give everybody as many opportunities as possible to ask questions or for clarification. So I'll pause for a minute if anybody has any questions. All right. If not, I'm going to dive in now to program eligibility. There's a couple of points that I just want to make right off the bat. And again, to be clear that those of you who are here today are here and understanding some general eligibility requirements for the program. And we're going to talk more about them in the slides, but I will explain a bit later in the presentation, but the recovery housing program here in New Hampshire, municipalities and counties are the eligible applicants for this funding. And if there are nonprofit entities who have a project to undertake, they could work with their municipality to apply for this funding and be a sub-grantee and to get the project moving forward. Unfortunately, for-profit houses are not eligible for this program. We certainly recognize that there is a high need of funding for-profit organizations and housing, and we are working to identify the best ways to support those organizations. But the funding opportunity that we're talking about today is just for municipal applicants and possibly for nonprofit subrecipients. And then the other thing I want to mention before we dive too much further in is that the funding opportunities and the uses for these funds that we're going to talk more about is for infrastructure, such as renovations or acquiring a building and to support recovery homes in that way, and not for operating costs or programming or that type of funding support. So the financial support, the types of eligible activities are actually for infrastructure, kind of bricks and mortar improvement or other work of houses or programs that support the houses. So with that being said, as the slide outlines, there are 3 key areas for the recovery housing program. Again, it's organized within the framework of the Community Development Block Grant Program. So for those of you that are listening to the presentation today that are familiar with this, with the Community Development Block Grant Program, these will all be familiar areas of compliance. But the main 3 pieces here are the national objective. This program, RHP program, is limited to limited clientele. That's the only national objective that you can meet, and it's been modified. Eligible activity, HUD has a typical list of eligible activities for the CDBG program. It's a pretty long list, and the RHP guidance kind of streamlines that list and minimizes that list of eligible activities. And so New Hampshire selected the activities that we're going to focus on based on that abbreviated list of eligible activities from HUD. And then the connection to program purpose, provide stable. So all projects must provide stable temporary housing for individuals in recovery from a substance use disorder. So it's a very, normally CDBG, there's a wide variety of types of projects and eligible activities again that can be funded under CDBG. Again, we're here talking about RHP today, and RHP is very focused on housing for individuals in recovery from substance use disorder. So those are some kind of key important pillars of the recovery housing program and how it differs a little bit from CDBG. And again, that's probably most important to those of you who are familiar with CDBG to kind of try to suss out some of the differences between the two programs. This slide just further talks about, gets into a little bit more detail about what I talked about on the previous slide. So there were a number of waivers and modifications that came out when this program was announced. And again, these are waivers and modifications that are made to the CDBG guidance, which is the framework for RHP. And they used that guidance and kind of tailored it to the RHP program. There were some of these waivers that were applicable kind of at a higher level, at the state level, when we got the funding and how we look to create the program and model the program. Some of those waivers and modifications impacted that. And then some of these waivers and modifications impact the actual projects that we can fund. And so that's what we're highlighting today here in this presentation. So again, like I mentioned in the previous slide, the limited clientele national objective that is comes from CDBG, that has been expanded under RHP. And so there are activities now include housing. So typically there's a list of activities that include acquisition, rehabilitation, reconstruction, and housing is now added to that mix specifically, and new construction in particular, that's not typically eligible under CDBG, but for purposes of RHP, new construction of new housing is eligible. And then there's been some additional presumptive categories added under the limited clientele. So all of the CDBG program projects and all of the projects under RHP, they have to predominantly serve low to moderate income individuals. And we'll talk more about that elsewhere in the presentation, but there's a variety of ways that you, as somebody coming in and potentially applying for funds, could demonstrate that the people being benefiting from the project are low and moderate income. And one of the ways that HUD says that we can do that is they have a list of groups of people that are presumed to be low to moderate income individuals. And those include the main list includes abused children, battered spouses, elderly persons or seniors, severely disabled persons, homeless persons, illiterate adults, persons living with AIDS, and migrant farm workers. So that's the kind of the basic HUD definition of if you are primarily serving individuals in those categories, they're presumed to be low to moderate income. However, under RHP, they've expanded and added 2 new categories under this, and it's persons insured by Medicaid. So if you're serving persons insured by Medicaid, that you can be presumed that they're at least 51% LMI, and then also persons who otherwise meet federal poverty limits. So if you have a way of tracking that by the people that your program serves, those are additional ways under this funding opportunity to be able to track that. And then the other piece that's different about this than CDBG is that we can fund projects that are located anywhere, eligible projects that are located anywhere across the state of New Hampshire. There are some communities throughout the country that receive funding directly from HUD, and they are what HUD considers to be an entitlement communities, and they get some HUD funding, including CDBG funding, directly from HUD. So in New Hampshire, those 5 communities that are entitlement communities, Manchester, Nashua, Dover, Portsmouth, and Rochester. Those 5 communities can't typically apply for CDBG funds through our office, through CDFA. They need to access CDBG funds directly through their municipality. However, this HUD funding, RHP funding, was not made available directly to entitlement communities. So we are able to make grants to entitlement communities for projects located within them. So that's a key difference with RHP than with CDBG, for those of you that know CDBG. All right. So this next slide, we attempt to simplify our explanation of kind of how funding works and who's eligible and who can apply. So RHP funds will be granted from CDFA to units of local government. That's kind of HUD speak for basically either municipalities or counties. So a municipal government or a county government can apply, can submit an application to CDFA for RHP funding. Those entities can directly use the funding for eligible activities that they're looking to carry out themselves, or they can essentially partner with a nonprofit organization that's located in their community, who may be the ones that want to undertake this project, and they can subgrant the funds to that eligible nonprofit organization to carry out the project. So we refer to those nonprofit organizations that are carrying out the project as subgrantees when there are subgrantees as part of a project. And again, like I just mentioned, projects can be located in both entitlement communities and non-entitlement communities. So essentially, they can be located anywhere across the state of New Hampshire. There aren't certain areas that aren't eligible for these funds. And I'll just note here too that the end users of the projects or activities that are funded in whole or in part by RHP funds are known as beneficiaries. So I may have already said that word a few times, but basically the beneficiaries are, for this program, the individuals who are in recovery from substance use disorder, who are, residing in these homes that, the funds are being provided by RHP to support. Those are what HUD calls beneficiaries, and what you may hear us say referred to throughout the presentation. But those are beneficiaries, are essentially those end users that are actually benefiting from this investment. And then there can also sometimes be indirect beneficiaries as well, not just the people that are directly benefiting from the project activities, but sometimes that, other ones in the community that might be receiving indirect benefits as well. So now we're going to talk a little bit about what types of activities can be funded with this RHP program. So as we noted earlier, CDFA coordinated with multiple partners to identify recovery housing needs in New Hampshire. And we're really grateful for all the time that those organizations and individuals spent with us kind of talking about the work that they do and the needs that they're seeing in different communities throughout the state of New Hampshire. The most pressing need we heard, which we mentioned earlier, by far was the need to add more beds, that they're really, in New Hampshire, the problem was that there weren't enough beds for the number of individuals seeking beds or needing beds. And that need is particularly exacerbated in parts of the state that don't currently have any recovery homes, or that have too few to serve the need of the area. So we also heard, again, that homes that are focused on underserved populations, including women and children, were another area that we wanted to focus on. And then we also, the third goal that we have is supporting and promoting community supportive partnerships in the co-location of recovery homes in communities that are in close support. In communities that have these programs and services in close proximity to these potential homes that we'd be funding. So we're looking for, supporting the overall ecosystem, if you will, of a community with programming and support, also in conjunction with recovery homes. So those are the primary goals that we ended up developing and, applying explaining to HUD is how we were going to use this RHP funding here in New Hampshire. So as I mentioned, HUD has a pretty extensive list of eligible activities that you can fund with CDBG programming. And then as part of creating, Congress creating the RHP program, they narrowed down that list even further to take out ones that wouldn't necessarily be applicable to recovery housing program. And then here in New Hampshire, after we identified the most pressing needs and developed our goals for the recovery housing program in New Hampshire, further whittled down that list into these eligible activities that are on the screen. And we've identified that these are the types of activities that we are able to fund, that you are able to apply for, and we are able to fund with RHP funding. As you'll see, these include potentially rehabilitation or work on public facilities at these public facilities. Again, it is part of the ecosystem of supporting recovery housing in that community. There may be instances where we could fund public facilities that support recovery housing. We can also support acquisition of real property. So that would be purchasing real estate, purchasing a building for use as a recovery home, for example. And then we can support the rehabilitation and reconstruction of both single unit or multi-unit residential buildings for to be used as recovery housing. And lastly, we can support new construction of housing to be used for individuals in recovery. So these are these areas here are the only areas that we are going to be awarding funding for through this funding opportunity. We certainly recognize that there is a need for funding support for operating costs and programming and those kind of areas that are needed to support recovery homes. But at this point, this is the lens, and these are the scope of projects that we can fund, the types of activities that we can fund with the recovery housing program. And so I think that is good for that slide. The next slide here just outlines what kind of funding is available to specific projects. So projects are eligible to apply for up to $250,000 per activity. So for example, if you're an organization that's looking to purchase a building to be used for recovery housing, but then that building also needs some improvements or renovations made to it, you could also apply for another $250,000 if needed to do that rehab on that building. So you could theoretically come in for $500,000 with $250,000 going towards the purchase price of the building, and then another $250,000 going towards the renovations. So you can do multiple, you could apply for funding for multiple activities. However, the total award amount that any one subrecipient or nonprofit entity could receive through this funding opportunity is $500,000. So if you had, say, 3 activities that you were looking to be funded, you would have to either apply for less than that $250,000 maximum. So the sum of the 3 would add up to less than $500,000, or you may want to focus your request for RHP funding on maybe 2 activities and then maybe use another source of funding for that 3rd activity. You could all get done at the same time, but you could only be applying for these RHP funds for up to $500,000. We certainly recognize that there may be projects that have a higher budget than that, a higher total project cost than that, and we'll talk a little bit more about that later in the presentation. This next slide just goes over some key pieces of compliance that projects receiving recovery housing would need to ensure occurs during the course of the project. So again, RHP funding is federal funding, and it comes through the Federal Agency of HUD, Housing and Urban Development. And so along with the federal funding often comes a lot of rules and regulations that you have to follow, and RHP is no exception to that. And again, because it's based on the CDBG rules and regulations, it's essentially all the same compliance areas that CDBG projects have to follow. RHP projects also have to follow types of compliance. So these include things like environmental reviews must be conducted on any of the projects before the project can get underway. There are labor standards such as Davis-Bacon and Section 3, for those of you who are familiar with federal funds, that have to be followed if there's rehabilitation going and construction workers, they have to be paid. The labor standards dictate the wages that they need to be paid, a fair and you know, amount determined by the federal government. Procurement is another area that has to be followed. So the federal procurement rules need to be followed for any type of contractor or, you know, individual that you're hiring to do the project. And then there's other types of compliance, such as the Uniform Relocation Act and contract compliance that have to be done. So I don't want to get too much into the weeds with, you know, details about what all these things entail and what they mean, but it's just to point out that there are these areas of compliance that are going to need to be followed, and we would work with you. We're going to talk, the next section, we're going to talk about who should be part of your RHP team and who will help with this, your RHP application, and then subsequently with the project if you're awarded funding. And there we'll talk about, you know, how you can get assistance with some of these areas. But just know that there are some strings attached, if you will, to this funding, that you just need to make sure that you are aware of that from the beginning and incorporate that into your project timeline and your project activities to make sure that those compliance regulations are met.
Molly, if we might just pause here, I think we have 2 questions in the chat.
Sure.
That would be good to address at this moment.
Sure.
One you might actually not know the answer to, but ask it. So they'd like to know, would you need a different type of liability insurance for women and children as opposed to a recovery home for men or women?
That's a good question that I don't know the answer to. That would be something that you would have to work out with. So we require proof of insurance, but you would have to work out those details of the type of insurance that you would need to with your carrier, and, you know, who's doing it. So we would not, you know, help determine that, but, you know, at the end we would, if your project's funded, we would require the proof of insurance. But that is a good question and something for all of you guys to consider if you are serving that targeted population.
Great. We also have another one about whether if a municipality receives the funds and provides them to a nonprofit, what are the expectations of oversight on behalf of the municipality? Do they need inspections or valuations? What does that look like? It seems like from a municipal perspective.
Yeah, that's a great question. And I do have a slide in a little, couple slides from now that we'll talk a little bit detail about that. But essentially, the municipality as the grantee, if the project is funded, is responsible for making that all these compliance requirements that come along with RHP, that they're met, that all documentation is kept on file. You know, recovery homes in your community are going to need to follow the typical kind of what's the word I'm looking for, like local rules and regulations, and you know, inspections and all those kind of things that have to happen at the municipal level. That is, you know, separate from this funding opportunity. So that you have to follow those regardless. But then there are, you know, the additional rules and regulations that ultimately the grantee is the one that is responsible for, even if they have a sub-grantee carrying out the project. And we'll talk in a minute about the ways that you can ensure that happens. Any other questions, Melissa?
We do. Yes, this is a hot spot to stop.
Perfect.
So we have a question about the limit on how long an individual can stay in the housing unit. And I believe HUD defined that clearly when they...
Yes, that's correct. So HUD does define that. And again, this is just for purposes of receiving this funding in the RHP program specifically, but they have a 2-year limit. So individuals in recovery could be for 2 years is the limit. And
similarly, but related, How long do you have to provide services to LMI if you're receiving the community development block grant funds? I don't know if there's a limit for RHP.
Yeah, so believe it's the same time frame. The minimum requirement for CDBG is 5 years. We like, and I do talk about this in a later slide, we do encourage it to be for a longer term than that, more than 5 years, but the minimum is 5 years that you would be committed to continuing to serve this the low to moderate income population, and also to be, you know, continuing to use it as recovery housing. If for some reason you can't do that, if for some reason, you know, something happens in a few years within that 5 years, the funding would potentially have to be paid back. So it's just important that it could, you know, potentially change into a different organization, a different entity, maybe, you know, carrying out those services in that facility in the future. If something happened to the original entity that was doing that, we could work with the grantee on that. So there are some, you know, some different directions that could go, but yeah, I would say 5 years is the minimum time frame, but we're looking for up to 20-year, you know, commitment if possible, to remain doing the stated activities that you're stating that you're going to be doing with this investment.
Excellent. And then thank you for those who clarified what Matt means. I had a blank. There's a question in here about, are there any restrictions for medical assisted treatment?
So that's a good question, and it reminded me that I did want to mention at some point during this conversation that, as you might have been able to tell, you know, we are certainly not recovery experts. You know, our primary role here in New Hampshire is as a funder, and we you know, provide funding to various types of community and, you know, community-based programs. And so we are administering this recovery housing program because it's essentially CDBG funds, and that's what we currently administer. So it made a lot of sense for us to administer this programming, but we are certainly not recovery, you know, experts in recovery, and we're trying to learn as much as we can. And we've done some other work as an organization in that area. So we'd like to think we're building up our knowledge in that area, but that's why we work so closely with community partners and others who do work in this space every day, like many of you likely do. And so we're still learning and trying to learn as we go. And the question about the Matt, potential complications is good. I think that is, you know, that is separate, I would say, in some ways from what we're trying to do. But I mean, if you guys are certainly providing medication assisted treatment, I think we could still fund, you know, improvements that might need to happen at your facility. But that, you know, you still have to maintain all the state level and federal level, you know, requirements for medication assisted treatment that you give, in addition to any, you know, additional rules or regulations that come along with receiving the RHP funding. I think we were envisioning mainly help assisting houses that are at lower levels of the recovery housing steps, if you will, and maybe that aren't providing medication assisted treatment. But I don't think that we're prohibited from doing that. We would just have to work with you, you know, prior to applying to make sure that everything aligns and that there is no issues there. But we could certainly talk more about that.
All right, and I think we have one more related to eligibility. If someone was to suffer a relapse, would we be able to discharge and outsource to a different level of care if the resident was willing?
That's another good question. And the answer, I think, is it you know, depends on your program and how you guys would handle that at the home level. But yes, that it's certainly, we are not going to prescribe how you handle that at our level at the RHP. So I don't know if that answers that question or not, but like if you have somebody that relapses and it doesn't jeopardize your funding if that person moves on to another type of recovery resource, and that bed is filled eventually by another person in recovery. It's up to you at your program level to determine how you're going to provide assistance to that individual, but we're not looking at that from our level.
Maybe, Molly, just a quick clarification, and if that individual came back and we're still within the 2-year time frame for being supported, they could still be supported within, if they were within that 2-year service time frame.
Yep. So the clock would just stop ticking when they left your facility and went to another type of facility to get assistance, and then if they came back, it would just that 2-year clock would resume ticking once they came back into the facility.
I think that's it for now. Really great questions.
Yes, great questions, and please continue to ask them. And again, I apologize if I stumble over any of them. Again, we are working to try to understand recovery housing as best we can, and I appreciate you guys, your explanations and helping us as we navigate through this important field. So this next section, we're going to kind of get into the nitty-gritty about the application process and kind of the overall steps to apply for a recovery housing program funding. So the first slide, we outline here the recommended recovery housing program team, the team that would be applying for funds. That would, of course, involve the CDFA staff, myself, and Kirsten, who spoke towards the beginning of the presentation. We are the 2 primary points of contact here at CDFA for this program. So it would mainly probably be us, but we also have a few other members of our team that mainly work on CDBG, and folks like Melissa, who's with us today, that may be involved in working with you for your RHP application. The second key player is the grantee or the municipality. They are, again, the grantee or the municipality is the entity that's legally, financially, contractually, and programmatically responsible for the RHP program. So there would be a formal sub-grantee agreement in place between the municipality and the subrecipient that might outline kind of the subrecipient's role in that, in all the aspects of that, but it is ultimately the municipality or the county, if it's a county applicant, that is responsible for all of that. Again, the third entity involved in this is the subgrantee, or often the actual applicant in some ways, the one that's carrying out the project. We refer to that individual as a subgrantee, and again, as a subgrantee to the municipality. And then the other key player that we have in this RHP team is a grant writer and a grant administrator. So for the CDBG program, applicants typically work with a CDBG trained grant writer to write the grant, because there are a number of compliance and rules and regulations and compliance pieces that have to be completed before you even submit the application, which I'll talk more about in a later slide. But it's important for that for the entities to work with in CDBG with a grant writer to help with that. Now, RHP applicants can also work with an application, a person to help them write the application, but there's nobody, this is a new funding opportunity, so there aren't individuals out there trained in the recovery housing program and how to specifically, apply for RHP funding. But the CDBG, the individuals that know CDBG would be a great resource, because they, again, know all of the compliance pieces that go along with CDBG, and most of those are applicable to RHP as well. And then, of course, the other entity that we have up here is New Hampshire Core. They are a key a key part of the RHP team insofar as that we are strongly encouraging all projects, if they haven't already done so, to get certified by New Hampshire Core and work with them to either get certified, explore being certified, all of those things. So they would be an important partner throughout the process of the project to work with you if you're not already certified. And of course, if you are already certified, to help you continue to maintain that certification. So there's just another key a key individual. So again, to talk a little bit more about the grant writer and grant administrator. So that could be potentially two different people, or it may be the same person. But a grant writer is somebody that helps, of course, write the grant and submit the grant. And then after a grant is funded, then the grant needs an administrator. In CDBG, you're required to have a CDBG grant administrator to help with all of those compliance pieces that I very briefly outlined earlier in the presentation that probably had a lot of terms and confusing regulations mentioned that you might not be 100% familiar with. And that's okay. The municipality and the subrecipient would rely on what is typically a CDBG grant administrator, but would step in and be an RHP administrator for this funding opportunity to help you make sure that you're in compliance with those rules and regulations. And that person can be funded as that funding can come out of your RHP grant. So you would include that as a line item on your budget, and you could, fund that individual to help you. So for CDBG, the grant administrator is typically, it could be a consultant, it could be the municipality itself. Some of the larger municipalities have staff that are trained to do CDBG grant administration. And then there's also quasi-governmental administrators like the regional planning commissions that often have staff trained to help with CDBG that would likely be able to help with RHP. So you would have to reach out to those individuals to see if typically a request an RFQ would be put out to engage with those individuals by the municipality for both a grant writer and then on the flip side if you're funded for a grant administrator. But it's important to work with that third party, particularly in the grant writing stage if you've never applied for CDBG or if you don't know those steps, because it's important that all of those pre-application compliance pieces are met, which I'll talk more about in a minute. The next slide, we kind of wanted to make sure we explain the importance of what we call pre-application meetings. And so before any funding opportunity, a deadline, we require projects to meet with us, with CDFA staff, to talk about the project and just make sure that everybody's on the same page. So for all the individuals that I outlined in the previous slide, from somebody from the municipality, somebody from the nonprofit organization, somebody who might be helping as a grant writer, and then a CDFA staff, possibly core if it makes sense, we would all be in on a RHP pre-application meeting to talk about the project, to ensure that it would meet all national rules and requirements, including the national objective. And then we talk about the application process and the key dates, and talk about any additional technical assistance that might be needed. So we set up those meetings, and we will be doing those over the course of the next few months for anybody that might be looking to apply for this funding opportunity. If you have any initial questions before you get to that point of pulling your team together, and wanted to have a quick conversation with CDFA staff, kind of a pre-meeting before this pre-application meeting with everybody, we would certainly welcome that. So I imagine, you know, in particular, some nonprofits, for example, that might be listening in today might want to have a quick conversation to say, hey, this is my project, and this is what I'm thinking before I approach all of these other entities. Would it make sense? And we could certainly work with you to schedule a brief meeting to discuss that if you would like, and we can talk about more at the end. We talk about the best ways to reach out to us to do that. But we do, as this is like an official kind of step of the application process, the pre-application meeting that we just strongly encourage everybody to do. It helps not only us at CDFA, but certainly you guys on that on the project side as well. This next slide just highlights how to apply. So I think most funding opportunities these days are you apply for them online, but just to be clear, there's not a paper application process for this funding opportunity. You would need to apply online through our grant management system, or GMS as we call it for short. The applicant, which again is the municipality or the county, and or the grant writer, should be the individual who registers in our grant management system and completes and submits the application. So typically the nonprofit is not working in the grant management system, but they are working closely with the others who are in the grant management system to help with the narrative, to draft the narrative section of the application. So they're certainly working on the application too, but they're not typically the ones in the system. It's streamlined. We recommend that it's streamlined to the municipality and or the grant writer actually uploading it and entering it in the grant management system. But certainly you should all be working on it, all involved in the project, coming up with the response to the questions and supporting documents and whatnot. We do have detailed instructions on our website about how to register in GMS and get started on an application. And so there's a couple different links on our page. One link on our page goes directly to the login for the grant management system. And this URL that you see on the screen here is the one that takes you directly to the login section of the grant management system. But also on our CDFA resource hub website, you can find that application, the detailed instructions about how to apply, frequently asked questions, and other things about our grant management system. And we just linked that in the chat. I can see for those of you who wanted to kind of who are new to GMS and might want to look at that information before moving forward with applying in the system. So I just wanted to point out that there's not only the link to log on to grant management, but also some helpful resources as well. All right. So on to the next slide, we talk about RHP fundability. And so for a project or for a project to be fundable, it must pass a two-tier test. So basically, all that means is it needs to be, the activities must be eligible. And again, we listed out those 4 different eligible activities in the earlier slides: rehabilitation, acquisition, etc. It must be an eligible activity. It must meet a national objective. Again, the national objective for RHP is that it must meet a low to moderate, it must predominantly benefit low to moderate income individuals who are in recovery. So that's the national objective, and it must meet those 2 requirements: be eligible and be meeting a national objective, both at the time of funding and also once the project is completed and it's executing. So you have to, for example, you have to commit to continuing to serve an LMI population, not just when you apply for the application, but also once the application, once the project is underway, you need to continue to meet that national objective or to serve low to moderate income individuals who are in recovery. So we are looking at that obviously early in the application review process, and even before you apply, in our initial conversations with you, we'd be looking to ensure that you can meet those fundability tests and be eligible for the funding opportunity. And then the next slide, we start talking a little bit about threshold requirements. So all applicants must pass both general CDFA application thresholds and RHP program specific application thresholds. This first slide just notes some of the municipal thresholds that must be met. And again, I mentioned these are the same as the CDBG program. So these include, before you apply for RHP funding, you would need to do some public noticing and have a public hearing to inform the community that the municipality is intending to apply for RHP funds from CDFA for such and such a project and such of amount. We have detailed instructions about how to go about that process, but that has to be done and documented before you even apply for RHP funds. It's a requirement, again, because it being federal public money, federal funds, it needs to be noticed in a public way. There's also some specific plans, such as the Housing and Community Development Plan and the Residential Anti-Displacement and Relocation Assistance Plan, which is a mouthful, but those are some planning documents that happen at the municipal level, and those are required for CDBG funding, and they're also required for RHP funding. If your community, if your municipality has already applied for CDBG funding relatively recently, those things might already be in place, and you might just have to update them for this process, or it might be that the community has not undertaken these things, they'd have to create them from scratch, but we have resources. We could certainly help you with that. We have templates available and can work with the municipality to how to go about and draft these plans and then get them adopted at the municipal level. But this is just to say that there are a number of steps that have to be taken before you even apply for RHP funds. And then the next slide just talks about some additional application thresholds that need to be met. These things are, just core eligibility criteria that need to be met from all applications. One of the key areas, several of these items on this list pertain to capacity. So we're trying to review applications to assess both the grantee and the sub-grantee capacity to successfully carry out this project. So we're looking at some of the financial documents that we ask you to include with the application and some other types of documentation that's being provided with the application to really determine if the entity has the appropriate capacity to successfully execute and work with federal funds and then successfully execute a project. We have a compliance plan where it's a template that we provide, and then we ask that to be uploaded with the application. So you kind of plan out how you're going to meet some of the key compliance areas. So the municipality would complete that with help from the grant writer and the subrecipient. And then we have some energy policy requirements. We encourage projects to incorporate energy efficiency components into them, and so we would talk to you more about what that entails and what that means for your application. But those are some of the areas that we look at kind of as a threshold, or initially upon the application coming in to our office after the submission deadline. There's a few weeks where these items are looked at before it even gets on to the scoring portion of the review process. So the next portion of the slides talks a little bit more in detail about the scoring criteria. I don't think it's been mentioned yet, but we do have a pretty comprehensive application guide, the RHP application guide, that's available on our website, and I believe the link's been sent out to you. But it gets a little bit more into the details, and I'm going to get into today. I'm going to go through kind of at a high level what these scoring criteria are and what they mean. But if you had further questions and wanted to better understand it, you could certainly start with looking at the scoring section of the RHP application guide, or you could, of course, contact our office, and we'd be happy to talk to you about any of these criteria. But overall, there are 5 different categories that we're going to be scoring on. These include community needs, statewide recovery housing needs, recovery housing priority needs, project-specific needs, and capacity. So I just have a slide for each of these 5 criteria just to kind of dive in a little bit. So the first one being community needs. So essentially, the CDFA created what we call a core data index a couple of years back in order to better get an understanding of the needs of different municipalities across the state. So the data that was used to compile this list and to create this index comes from a variety of different sources, including the Census Bureau, the Department of Health and Human Services, New Hampshire Housing Finance Authority, and the New Hampshire Office of Strategic Initiatives. So there's a number of different data points that kind of are looked at to create this list. The data was compiled in conjunction with the New Hampshire Fiscal Policy Institute. And so this list is based purely on where the project is located. So it's the list is in the back of your RHP application guide. One of the appendixes, I believe it's Appendix C, includes the what this raw number is that was compiled as part of this index. And there's more information on our website too, if you wanted to, if you were curious and wanted to further understand the methodology and what went into creating this index. But what you would just have to know for you, if you were trying to get an idea of what your score might be, is that you would look at the back of the back of the guide, Appendix C, and find, say, the project's located in Concord. You would find Concord on the list and then see how many points Concord gets for this criteria, this first criteria. If you are applying through the county, if it's a county-wide, if it's a project that encompasses a couple different towns, you may be applying with the Merrimack County, for example, or Grafton County. At the county level, you would use the number for the county. So, you know, whoever the applicant is, if it's the municipality, you'd be using the municipality number. And if you're applying through the county for a regional level project, it would be the county level. So that's a pretty cut and dry number. And if you have any questions about that, let us know. The next section is the statewide recovery needs. This criteria prioritizes projects doing high priority activities. So again, we talked about the kind of how we whittle down the list of overall eligible activities to the ones that we're focusing on in New Hampshire. And then you'll see in this area, we give the highest number of points, you know, up to 40 points for those projects that involve acquisition, new construction, essentially new beds, adding beds to the existing, amount that we have currently in the state. Medium priority activities are, you know, rehabilitation for existing beds. So there's also, of course, a need to continue to support the current beds and not lose beds. So this is where, you know, projects in that area, if you have an existing home but are looking to rehabilitate and, you know, possibly add beds, it might be part high priority, part medium priority. But that's where the medium priority activities come in, or kind of supporting existing beds. And then the low priority activities, but we could potentially fund, is the rehabilitation of an existing public facility where recovery services are provided that, you know, we can see are directly supporting recovery housing in the community. So again, it has to be tied back to recovery housing, but sometimes there might be a need for these nonprofit organizations that are in the community that are providing support to individuals that are in nearby recovery housing. And so we might be able to provide funding through this funding opportunity for those projects, but they have the lowest priority. Again, and that's not to say that they're not important. We certainly recognize that all of these activities are really important to the overall health and growth of the recovery sector. But this is just, again, looking through the lens of the recovery housing program and what we're able to fund with this funding opportunity. The next slide talks about high priority areas of the state. So the last slide was pertaining to the activities that were being funded. In this criteria, we're looking at the geography, so where this project is located, and specifically if there are any other, what the status of recovery housing is in that area now, and how your project plays into that. Is it new? Is it expanding, et cetera? So you get the highest amount of points for if you're located in an area that has no houses or insufficient houses right now, for example, that those would get the higher numbers. Again, it's very similar with the population served. If it's serving a population that's not currently being served in that area, for example, women and children, maybe there's a recovery house already in one part of the town, but it's just open to males or individuals, not open to families, and your project is addressing women and children, for example, you may be able to get up to 25 points in this area if you're serving that priority population. And then lastly, under this umbrella is community supports. So if you can demonstrate partnerships with the critical services that are listed on this slide, things such as transportation, job placement, childcare, et cetera, and how your program integrates with those other important community resources in your community, you could get additional points for that. The more points, the more, the more services you're integrated with and can demonstrate you have a relationship with, the more points you would get under this criteria. And then the next one, I know these are all have very similar sounding headers to them, but I'm just trying to point out kind of the differences. So the first one was activity. The next one was the last one we just talked about was kind of proximity, like where it's located and the populations it's serving. And now this section, the project specific needs, is talking specifically about how you can demonstrate in your application how your project is impacting a regional or a community need. And so not just, what your project is doing in and of itself, but again, we're looking for that tie into what's going on at the larger level, either whether it be a community level, a regional level, or it, could potentially be statewide level as well. But we're looking for you to kind of articulate how your project fits in to that, so to some of the larger efforts already underway in this area of substance use disorder in individuals in recovery. And then we're also awarding points, you'll see on this slide, that goes along with that long-term benefit that we talked about earlier. So, we have a minimum of 5 years that we want you to be able to demonstrate that you will remain serving low to moderate income individuals who are in recovery. But if you're able to demonstrate that you are going to be committed to that for a longer term, whether it be by a lien placed on the facility or some other mechanism, then you could potentially get more points in this area. And then lastly, we are up to 30 points total for capacity. There's a couple of different subcategories of capacity that we have. We're looking for projects, essentially, we're looking to fund projects as close to shovel ready as possible, which I know is often the case with a lot of funding resources. But again, we're looking to get this money into communities as soon as possible. So, we're going to be looking to look for projects that already have some idea, that have some drawings at least started with an architect or an engineer of, what the expansion, for example, might look like, or what the improvements might look like. And then also that there's some cost estimates that have already been drafted up, maybe through a contractor that has walked through and been able to do a kind of a high level kind of estimate for you. So we know that the project's well on its way to moving forward and would be able to, firm up these things and continue moving these things pretty soon after being funded. There's no match requirement, so you do not have to have a certain set amount of match to access this funding. However, if your total project cost exceeds the amount that you could apply for with RHP, you would need to have that whole budget, the whole total budget amount secured at the time of applying. So if there are other resources that would be contributing to the overall project, that's great, but we would just need to see that that's committed or secured at the time of application. And if you're applying for it, 100% with RHP, we would just need through the course of answering some of the questions on the application to better understand why, your organization is not able to fund that directly themselves, so just kind of what the other high priorities are in the organization and why or why not you're not able to fund it and why you need support from RHP for it. And then the last piece is that New Hampshire core certification that I mentioned earlier. We, again, recognize the importance of recovery homes and meeting minimum requirements and following best practices, which New Hampshire core helps recovery homes in the state do. So we are strongly encouraging all projects, if they're not already certified by New Hampshire core, to become certified by New Hampshire core. And so we do recognize that depending on where you are in the process of starting a recovery home, you might not be far enough along to get your certification, but we give points, if it's complete, but we'll also give points if you started that process and, maybe you're not able to get there yet because you haven't been able to get the occupancy requirements quite yet that you need to get that final certification. We will still give points to folks that are already underway and working in that process of their New Hampshire core certification. So again, that's just a really high level of the scoring areas, but refer back to our RHP application guide to get a little bit more detail about that, and let us know if you have any questions, if any of those scoring criteria are confusing, just let us know. The next slide here talks just a little bit about the timeline. So it's somewhat unique how we're rolling out this funding opportunity, but we're really trying to make it as accessible to as many people as possible. So we have an initial application deadline of Monday, December 19th, which I know is coming right up. We're already at the end of October, but we are looking, hoping that some projects that already have projects identified and that, might be underway in the process could, get your applications submitted to CDFA by December 19th. We'll review those initial applications as part of the first round and be able to hopefully award funding soon after that by projects finding out sometime in spring 2023 if they're awarded or not. We will also, if we are not obligating the total amount of funds we have available, if we don't get enough projects to obligate it all in that first round, we're going to have a rolling application deadline moving forward into the spring of 2023, so that we'll be accepting RHP applications as they come in, and then we'll be grouping them with other applications that come in that 60-day period as kind of additional rounds moving forward until all the funds are expended. So you could certainly contact us if you have any questions about the timing, but that is the hope, to have that initial round, and then if there's still funding available, have rolling applications to really try to support as many projects as possible. As far as the application process, you apply through the grant management system by the December 19th deadline, or after if you're doing the rolling deadline, and then the applications will be under review at CDFA for a few months to do those threshold reviews we talked about, and then the scoring reviews, and there's kind of a couple different tiers of the review process that happens. And then all projects will be brought before our Community Development Advisory Committee, or CDAC that we call it. Again, that's the Community Development Advisory Committee. They're the entity that reviews all of our CDBG funds. We met staff, and staff makes recommendations to them on what projects to fund, and they review and approve projects for funding. So RHP projects are going to go through the same process. And then once projects are awarded at CDAC, contracts will have to be drafted up between CDFA and the municipality, the grantee, that will need to be finalized. And then the last step of the process is going to Governor and Council to get that contract approved by Governor and Council. So it is a bit of a process from when you would come in and submit your application into when you would be through the whole review process and essentially get the green light to start your project. And then by starting your project, we mean to start on the environmental review and some of the other pieces. Some of those, you might be able to to start some pieces early on. We would be in touch with you to talk about how to, you know, most quickly move your project forward. But I just want to be very clear that it is a several month long process of review and multiple steps that has to happen before the funding is available to you as an organization to implement the project. And the funding is you know, reimbursement. So you would be completing the work and then submitting, the municipality would be submitting requests, claims to get the funding from CDFA for the project. And typically the project timeline for projects is we're looking for projects to be completed within 18 months of getting your signed contract. If there are, you know, delays that are beyond your control, sometimes that can be extended up to 24 months, but we're really looking for timeliness for HUD to get the money moving, that, you know, once your contract's signed, that you would be completing your project within 18 months or so. This next slide just addresses a couple FAQs that we've had already heard a few times from some different entities. The first one asking, can we use this funding to update existing structures to conform to current fire and safety codes? And the short answer is yes. That would fall under, you know, improvements and rehabilitation of an existing home. So if those improvements were needed to, you know, upgrade the facility, that you could possibly apply for RHP funds to help with that. Can we use this for a project that is already started? That's another good question. The answer is probably no, because of, you know, a lot of the rules and regulations that need to be followed and in place before you apply for the funding, and then before you execute the funding. If it's something that's already underway, it wouldn't be, you couldn't go back and fund it with RHP funds. However, if you are, say, working on a phase of a project, but then there's a later phase that you're looking to do with additional funding, should you get additional funding, while technically it might be the same project, if there's clear delineation between what's already been done and like another phase, that could potentially, we could potentially use RHP funding for that. And then the other question is, can we use this funding as a private business who is already involved in providing recovery housing solutions in New Hampshire? And that's a great question, because we know there are certainly a lot of you out there that are for-profit houses or organizations that are providing this really important you know, service to New Hampshire. But at this point, the RHP funding is only available, the only eligible applicants for this funding is municipalities and counties on behalf of nonprofit organizations. So this funding would not be able to be you know, applied for from a for-profit recovery home. And then the next slide just gives some important links at the federal level. HUD has some great resources and overview of the recovery housing program. Keep in mind that there are some overarching rules and regulations that come from HUD that kind of guide how we develop the programs, but then each state then looked at the needs and the infrastructure, the current partnerships, all those kind of things in their state, and kind of came up with their own action plan. So if you, by, you know, doing any look at the national level, what's going on, you might see some similarities and some differences between the 25 states and how the funds are being utilized in the different states. But I think it's good if you're curious and want to know more about RHP and the overall program at the HUD level. You can definitely follow these links. Again, we have our next slide has some links to our how to schedule a meeting with us. So we have a link on our website to schedule a meeting. So whether it be an initial conversation, if you want to touch base with us first, if you have some questions after listening to all of this today, we'd be happy to have an initial conversation with you. Or if you want to already know, you already have can pull together a team and know that you can move forward with submitting an application, we could jump right to a pre-application meeting. But you can do that. The best way to do that is through our schedule a meeting link that's right on our CDFA website, which is linked here. We also have a special page of our website dedicated to the Recovery Housing Program opportunity, where it links our action plan, and it links to our RHP application guide. So you could certainly, while you're at our website, take a look at those materials. We also will send them out to you, and we'll continue to send out links. So we're trying to blast that information to you as many ways as possible. But make sure that you visit our website, because it has a lot of great resources. And then we also have Kirsten and I's email addresses here, so don't hesitate to reach out to us after this. I know I talk fast, and this is a lot of information, particularly to somebody who is new to HUD funding. So if you have any questions, don't hesitate to reach out to us. Kirsten's going to be doing her best to coordinate this, so if possible, first reach out to schedule a meeting, or if you have a quick question, I just ask that you reach out to Kirsten, and then she'll either help answer that question or forward it on to me if it might be better suited to my answering that question. And we'll try to get that to streamline our responses to you. And we're trying to also keep track of everybody that we touch base with about this funding opportunity. So we're just trying to direct you to Kirsten first if possible, and then we'll certainly follow up with you at that point. And then this just has the general link to the CDFA website, and then our main phone number. Again, though, reaching out through that schedule a meeting or email probably is the best way to reach out to us, but we are happy to chat on the phone. Sometimes that's easier than trying to put your thoughts into writing, and we certainly get that. So at this point, we've concluded the actual presentation, the formal presentation part of this overview, but we wanted to make sure and it's perfect, we have plenty of time for questions now. So I don't know if we want to start off with the audience, or if Melissa, if you had any that came in since we last paused for questions, you wanted to maybe start with some of those ones that are already in there.
Hey, Molly, we don't have any additional questions that came in through the chat, but I'm wondering, we could take the presentation down and just invite people to unmute and maybe ask questions if you think that works. Great.
I think that'd be great.
Hi, good afternoon, ladies.
Hi, Sally.
Hi.
Yes.
Is the December 19th deadline a letter of inquiry, or is it actually the initial application?
Yeah, that's actually, it's a good question. It's actually the application. So I do recognize that that's not too far away, but that is for the whole application being submitted through the grant management system. We are not taking like letters of intent, or and we don't like make reservations or anything like that, which some other funders do. It would just be that's the application for submitting it for the first round.
Okay, thank you.
Yep.
And Molly, just to clarify, folks should be able to see the application if they register for our grants management system, or maybe we can circulate a copy of the application so people can kind of see what's involved. And give
I think we'd be happy to do that. I don't think it's currently, we don't have that currently available, but we can make that, as Melissa just noted, and make that available. So because you can log into the grant management system and see that whole application. But for example, if you are not sure, if you're wanting to even apply at this point and wanted to see, the application to help inform your decision on that, we could get a draft of that out, and we could certainly send that out to everybody who participated today, and also put it on our website so you could see that. But it is currently available in the grant management system. It's the funding opportunity is already launched and already live in our grant management system, so you could go in today if you do already have access to our system from previous work with CDFA, and you could see that funding opportunity and click on the application today. Any other questions? Well, thank you, everybody. I'll stay on for a few minutes if anybody, wants to wait till a few people jump off and be more comfortable asking questions. But please don't hesitate to reach out individually if you have very project-specific questions that you wanted to talk about as a follow-up to this presentation. And again, thank you for your time today and for joining us on behalf of Melissa, Kirsten, and I, and the rest of the team at CDFA. Thank you.